pain hurting you more than you thought it should. Being a new mom, everything's supposed to be perfect, right? But breastfeeding isn't always comfortable, especially in those first few days when you are not used to having those nipples sucked on all the time. Now, nipple pain, it is something that people deal with all the time, and I'm here to help you through it. Let's talk about why it happens and how to fix it. First of all, we have a shallow latch is by far the number one reason. A shallow latch is when that baby latches on just the tip of that breast and that nipple and just takes that very first portion of that breast where, think about laying on a bed of nails. If you lay on one nail, it's gonna go right through you, but to lay on a whole bed of nails, all of that pressure evens out and you feel much, much better. Making sure that you get that whole nipple in that baby's mouth, giving a lot of good head support so that they're not able to pull back and recorrect themselves because they will only take what they want. So be very diligent in keeping that head supported and getting that big mouth around that nipple before they start sucking. Second thing, oral restrictions. I'm sure most of you have heard of lip ties, tongue ties, and the sort. A lot of babies are overdiagnosed with tongue ties. Most are still able to pull their tongue out past that gum line, past that lip line to get that cupping shape they need to get around that breast in order to have a good latch. If your baby's not able to pull that tongue across that lip line, that's when we have an issue. If you can see that frenulum under the tongue and it seems like it's keeping that tongue tight to the mouth, that's when we need to talk to a pediatrician or an oral dentist, like ENT, someone that's qualified to do a little tongue clipping. But make sure that it's needed before you go through it. Number 3, infections. Sometimes we can have thrush on our nipple and pass it back and forth to baby. If you notice white spots in the baby's mouth, or when you're latching on the breast and it hurts and kind of burns and has your nipple might have a beefy red appearance or be really tender right after the feeding, kind of a burning sensation, and you might see some white plaque on your nipple as well in between feedings. That's when we want to talk to the pediatrician and get some help for thrush. Bacteria is not as common, but it can happen, especially if you end up with damaged nipples in the beginning with sources of infection that can get into those cracked areas. So making sure that you don't see any swelling, redness, or pus at that site. And again, if you need help and confirmation of a medical diagnosis, go see your OB. Number 4, vasospasms. Sometimes you get that really intense tingling or burning sensation when you go from hot to cold. Babies' mouths are hot and it's cold air afterwards. So sometimes that vasoconstriction can cause some pain or tightness and it makes it really painful. Sometimes that pain lingers and shoots deep into that breast tissue after a feeding. That's something we want to talk about for getting some warmth on there, making sure that there's more of that temperature stability. Skin conditions like eczema or psoriasis can also cause some skin pain and nipple pain with that baby on that breast all the time. The saliva breaks down food, it also breaks down skin. So when we have a baby who's on the breast all the time, it can really affect the skin on our nipples, especially if you're already prone to eczema or psoriasis. So make sure that that skin is healthy. Sometimes you need to do a little nipple balm, but sometimes that's not even enough. Maybe a little hydrocortisone just on that site occasionally, but then wiping it off before baby eats again. Sometimes we have dysfunctional suck patterns in these little ones. Newborns don't know how to suck all the time, especially if they're premature or have some neurological immaturity. They can have a really irregular suck. Sometimes it's more painful than it should be. Sometimes it's more in a different alignment with what our breast is used to. So taking care of that and making sure you talk to a lactation consultant to see if we can get some oral motor skills and some help to get a better latch on that. How to heal your breast after you've already experienced nipple damage, how to make it feel better and recover from this so you can keep on your breastfeeding journey. That's what we're going to talk about next. First of all, like I talked about, saliva breaks down food, also breaks down skin. So when your baby's done nursing, dab off from the saliva, let it air dry, and then try to express some milk from your nipple after your baby has fed already. Just a drop or two. Use your fingers, rub it around, let it air dry, Then use your nipple cream, whatever you have in stock. It could be lanolin free if you're sensitive to lanolin. It could be the any mother's butter. Any of those ones are probably fine. You can use breast gels if you feel like you're really sensitive to clothing rubbing against the bra or your shirt in between feedings. They have breast gels that will help prevent that rubbing and that friction against your clothes. Hydrogel pads are also things you can keep in the fridge, and then after feeding, put those gel pads on the nipple, and that'll help soothe that pain that you've already had and help recover. One of the best tips that I've found in the recent years are the silver cup. The silver nipple cups are such a good relief for those damaged nipples. All you do the same things we talked about. Dab off the saliva, express the milk, rub that around your nipple, let it air dry, use your cream, and then put the nipple cup on that nipple and then put it in your bra. You can do that in between every feeding, and it should help heal much, much faster. For these and other tips, keep watching this channel, and we'll see you next time.